Good morning, everyone. So I'm going to give you an update since last time we spoke and we'll get started. So again, in the past, before 2004, there was no radiation facilities in Oman. The first center, the National Oncology Center, was opened in 2004. It's an annex building to the Royal Hospital and has two linear accelerators, one HDR, one conventional simulator, and one CT sim. So basically, since the center opened, this is the Royal Hospital Center. We opened our center in 2000, Comprehensive Cancer Center. We're very proud of it. Since we're very proud of it, I have to show you a video.
يعني حالة متكاملة لمدة السرطان وفقا بسبب علاج علاجي. تتعمق إحداث متخصصة مزودة بأحياء جيدة والتقنيات التقنية. تأتي في مقدمتها وحدة علاج الأولي بالإشعاع ووحدة الأشعة الوحيدة النووية التي تختص بالتصوير التشخيصي والتداخلي. فريق متكامل يعمل بمريض في عمليات الخارج العام. وكذلك وعمل في العمليات المناعية. ووحدة متخصصة في إجراء العمليات الجراحية.
So, what is the scenario in Oman? So we have a population of 4.6 million. What I want to highlight here is the population pyramid. We have a very similar population pyramid in the whole of our Metro region. Very young population, very few. We need to talk about that. The cancers are well known. Male, it's colorectal cancer, followed by prostate and stomach, and women, it's breast, thyroid, and colorectal. This is the distribution. So breast cancer is really very, very common, and that's the same in the region again. So for some reason, this is not showing. So total number of cancer cases is 2,307. And now, if we look at the linear accelerator requirements for Oman, we're actually in a unique situation in Oman because we have a stable population that where we know exactly how many cancer patients we have. We know how many linear accelerators we need to treat those patients. And if we look at the different ways of calculating linear accelerators, you get different numbers. Corsair, 32 units, no way, that's a major exaggeration. Histoquartz, one linear accelerator per 400 patients per year. We're talking about 5, or if you use the other parameter of 1 linear per 180,000, that's 25. And then the new IEA method, which combines incident, machine workload, etc., comes to 2.8, which is approximately 3 linear accelerators, which is, again, that's an underestimate. So the reference of our data is the Oman Cancer Incidence, which has been running since 1985. It's a population-based cancer registry, one of the, it's a well documented cancer registry program. So the other thing I wanted to highlight, obviously, is cancer is age-related. So we can't take the parameters that are being used in Western countries, a very mature pyramid, and say, this is the number of linear accelerators they are using, this is the number of linear accelerators we're going to use. So, speak in terms of access, etc. So when you look at the requirements today, so we have a population of 5 million in Oman right now. Number of new cancer cases, 3,715. Number of cancer deaths, 2,029. And number of prevalence of cancer is 1,386. So again, if you use the same parameters, that will increase to number of linear accelerators, 35, 9, and 28, and 5 for the IAEA. So how many centers do we have? We have 2 centers. How many linear accelerators do we have? We have 4 true beams. 1 CyberKnife S7, and 1 empty bunker for future expansion, or MR-Linac, hopefully. We have 2 CT simulators, we have an MR simulator, we have 1 conventional simulator, putting all the centers together. We have 2 HDR brachytherapy units, we have an LDR service, and we have a 3D printing service also. So I think this is an opportunity that we need to work together on. And I think our first speaker has highlighted this. Mestro is an opportunity for us to get together with the regional leaders so that we can create a calculation method that actually fits our regional requirements. The modified IA method of calculation is actually very close to what we need to work on, but I think we can modify it to fit our demographics, our cancer patients, put in additional features like access, etc., so that we can come up with a model that we can use in our region and help other centers to define how many lean accelerators they need. Because when you're talking about, for example, in Pakistan, 200 lean accelerators, is that enough? Is that too little? Is that too much? How much money will that spend? So it's really important for us to use a calculation method where that is. In our region, we have areas that are very well covered, and we have areas that are undercovered. And we can use the information that we put together to come up with a model that helps centers to get the best number of lean accelerators. So another update, obviously, since we're updating for Mestro, we're working on a Mestro quality project at the moment to look at access and need for regional incidence reporting registry. It will be discussed in more detail by Mr. Val. I'll give you a few pictures of Oman just to change the mood. This is Salalah. This is Muscat, this is the mountains, Jabal Akhdar. But what I want to highlight is there is a project that's going on right now by Dr. Caroline Jabour, collecting data for all the centers that are available in our region. I think this is a very important stepping stone in order for us to work together with this type of a project in order to create a model of how many lean accelerators we require. In Oman, I can tell you, I've not said till now, that we need 5 lean accelerators to cover the population adequately with what we have. And I've just told you what the data is. That's all we need. How did we come up with that number? It depends on our population base, etc. But we need to look at what are the factors that made 5 lean accelerators enough for Oman, and why is it different for another area? So we need to work together to do that. And Mestro is the way to go. Thank you very much.